Dr. Ara Deukmedjian, CEO and founder of the Deuk Spine Institute. I'm here today to talk to you about the new article that came out from the Lown Institute on unnecessary spinal fusions being performed in people, specifically Medicare-age patients. These are patients who have Medicare insurance, either traditional Medicare or Medicare Advantage. The study claims that there has been basically $1.9 billion wasted of Medicare tax dollars paying for spinal fusion surgery that is not medically necessary. That's the allegation in the article. We're going to take a look at it and kind of see how it breaks down. But the concern about doctors, surgeons recommending spinal fusion surgery or any type of invasive spine surgery to patients who don't need it has been a growing concern over the last several years. And it is a concern of mine. I've expressed it to patients over the last 20 years, as a matter of fact, that there are far more surgeons today who are recommending spinal fusions and invasive spinal procedures that are not necessary and are harming patients, hurting patients, rather than helping them. So what can be done about it? Well, first of all, awareness. You got to know that this problem even exists. Most people out there with debilitating back pain that are recommended for a spinal fusion, they're desperate. They're in pain. The pain is affecting every aspect of their life. A lot of times they've tried treatments like therapy, pain medication, injections, and they don't know what else to do. So they get sent to the surgeon in hopes that they can have something done that's going to fix their back and neck pain. A lot of these patients, according to the study, have undergone unnecessary back surgeries, and that's cost our system $1.9 billion. Now, this is over a period of 3 years, and of course, many of those people are still in pain and they're suffering. Well, let's dig into this article just a little bit more. So basically, the Lown study found that the highest rate of unnecessary spine surgeries were being done in California and Florida on Medicare patients. Texas and Florida had the highest volume of unnecessary vertebroplasties. That's where the surgeon puts cement inside a fractured bone in your spine. It's a different procedure than a fusion. The problem is Medicare is spending all these billions of dollars that they're spending on unnecessary spine procedures. In my opinion, today, the age of 2025, spinal cord stimulators, spinal fusions, laminectomies, microdiscectomies, a mild procedure, facet treatments like RFA, barricade device, or percutaneous vertebral body ablation. All of these treatments don't work, and every doctor knows that they don't work. They'll never tell you that they're going to cure your pain, but they recommend these treatments anyway to patients. Patients go out and get the treatments, and sometimes they feel better for a few weeks because the doctor put some steroids in there. Of course, the steroids are going to make the patient feel better for a few weeks, and then the steroids wear off. And then they have this expensive, invasive procedure that's not helping, but actually making them worse. That never happens at Deuk Spine Institute because we don't offer those treatments. Those are old treatments. They should be thrown out into the garbage can. And doctors should be offering minimally invasive endoscopic Deuk Laser Disc Repair, minimally invasive Deuk Plasma Rhizotomy for facet pain and SI joint pain, and minimally invasive Duke Piriformis Release. These are the future treatments for chronic back and neck pain. And with those treatments, we can literally cure 99% of chronic back and neck pain here at Deuk Spine Institute. So please don't put yourself through unnecessary spine surgery. Come to Deuk Spine Institute where our treatments work. We have over 400 video patient testimonials of real patients out there who had our treatments and are cured of their pain. Hope you consider Deuk Spine Institute. It's been a pleasure talking to you. And please follow our podcast or visit our website and YouTube channel to learn more. Have a great day.